Hi guys, I'm Rajesh and today we are going to learn and understand HIPAA privacy and security. This is the disclaimer for this presentation. The presentation broadly covers some of the important topics such as what is HIPAA, what is PHI, what is considered as PHI, what are the different rule sets under HIPAA such as privacy rule, security rule, the enforcement rule, and the breach notification rule. So let us understand what is HIPAA. The HIPAA acronym is Health Insurance Portability and Accountability Act of 1996, which is part of the 45 Code of Federation Rule, parts 160 and 164. HIPAA provides a framework to the covered entities and business associates for establishing nationwide protection of patient confidentiality, security of electronic systems and data, standards and requirements for electronic transmission of health information or data. So let us understand what is PHI. The PHI acronym is Protected Health Information. PHI is individual identifiable health information that is created or received by a healthcare provider, a health plan employer, or healthcare clearing house. In a very layman term, this would be the doctor's office or the insurer. It relates to the past, present, or future physical or mental health or condition of an individual. So the record contains the past, present, and the future physical or mental condition of the patient. It relates to the provision of healthcare to an individual. It may be for the past, present, or future payments for the provision of healthcare to an individual. So let us understand what is considered as PHI. The HIPAA regulation requires to protect the PHI in all media, including but not limited to PHI created, stored, or transmitted over the network in on the following media. That could be a verbal discussion about the patient record, either in person or on the phone, a written on paper, chart, progress notes, encounter forms, prescriptions, X-ray orders, referral forms, and explanation of benefits or EOB forms. Computer applications and systems storing the patient data, which is electronic health record, or the practice management data related to patient or the lab and X-ray reports. Computer equipments or hardware, which is storing the patient data, which could be your laptops, your PCs, your PDAs, pagers, faxes, machines, servers, and cell phones. Let's understand other examples of PHI or health record, which would be encounter or visit documentation, lab results or reports, appointment dates and times of the patient, invoices issued to the patients, radiology films and reports, history and physical health record of the patient, patient identifiers or 18 identifiers of the patient. Let us understand the different HIPAA rule sets. The first is the privacy rule, second is security rule, enforcement rule, and the final omnibus rule, which also had explanation on the breach notification rule. Let's understand each rule sets, beginning from the privacy rule. The privacy rule went into effect on April 14, 2003. The rule refers to protection of an individual's healthcare data. It also defines how patient information can be used and disclosed. It gives the patient privacy rights and more control over their own health record or information. It also outlines the ways to safeguard protected health information. The key privacy rule guidelines are HIPAA's permitted uses and disclosures. Example, when PHI can be exchanged under HIPAA without first requiring a specific authorization from the patient, so long as other protections or conditions are met. Disclosures for public health and research and incidental uses and disclosure. A right to access health information. This guidance explains the importance of providing individuals with the ability to access and obtain a copy of their health record. The other guidance explains the ways in which health information collected from or created about participants in a wellness program offered as part of a group health plan is protected by HIPAA. Let us move on to other slide with more guidelines. The other guidelines are de-identification of protected health information in accordance with the Health Insurance Portability and Accountability Act of Privacy Rule. The provider guide communicating with patient's family, friends, or other persons identified by the patient. This is a guide for healthcare providers to help them determine when they can disclose a patient's health information or record to their family or friends or identified person by the patient. The guidance on sharing information related to mental health. This guide addresses questions about when it is appropriate under the privacy rule for a healthcare provider to share information about a patient who is being treated for a mental health condition. Misleading marketing claims. This notice addresses marketing claims that suggest compliance programs may be endorsed by HHS. HHS and OCR do not endorse any private consultants or education providers, seminars, materials, or systems, and do not certify any person or product as privacy rule compliant. And the last part is designate a privacy advisor for an entity. In this slide, let us understand the HIPAA security rule. The security regulation went into effect from April 21st, 2005. It covered mostly the confidentiality of electronic protected health information, that is EPHI, how it was being stored, the storage of electronic protected health information, maybe on the systems, servers, or devices, and how the access to health record or health information was available to users or to the patient. In this slide, let us understand the security rule guidelines. These guidelines are broadly been described in three different areas: administrative safeguards, physical safeguards, and technical safeguards. Let's understand each of them broadly. The covered entities and business associates must establish policies and procedures as required and must be followed by employees to maintain security. The physical safeguards would be more towards physical barriers and devices to access the area where PHI systems are being hosted or users usually access those records that must have locked doors. It should also monitor visitors if they access those areas, and these systems must be attended to secure the access. The third and the final safeguard is technical safeguard. The technical safeguards is more towards systems and technology, the access levels, the access rights to the PHI systems. They should be well defined. All of the desktops and laptops which have access to the PHI or to PHI systems must have screensavers, and these devices must carry ID badges. And lastly, the PHI system should have audit trail or audit logs maintaining the access, modification, creation, or deletion of records, which is specific to patient records. So as we understood from the previous slide on the administrative safeguards, it is important for the covered entities and business associates to establish organizational level policies and procedures and documentation requirements. There should be annual risk analysis and risk management program in place. The Health and Human Service has also developed guidance to provide HIPAA covered entities with general information on the risk and possible mitigation strategies for remote use of and access to ePHI, which is through remote use or access from a desktop or a laptop or from mobile devices, and more information on ransomware or other viruses. The other guidelines which an entity should also look for is the NIST 830, which is more on the risk management, NIST 852, which is on the guidelines for the transport layer, which is TLS, which uses FIPS 140 and 2, NIST 866, which talks about resources and guide for implementing the HIPAA security rule, 877, which talks about IPsec and VPNs and the best practices, 888, which talks about guidelines on computer security and media sanitization, which is electronic media sanitization, the guide to storage encryption technologies for end users devices is with NIST 800-111, and the NIST Special Edition 800-113 Guide to SSL VPNs. All of this should help an entity to build a security program within the organization. The enforcement rule contains provisions relating to compliance and investigations, the imposition of civil money penalties for violation of the HIPAA administrative simplification rules, and procedures for hearings. And lastly, the final omnibus rule. The US Department of Health and Human Services, Office for Civil Rights, announced a final rule that implements a number of provisions of the Health Information Technology for Economic and Clinical Health, which is HITECH Act, enacted as part of American Recovery and Reinvestment Act of 2009, which was to strengthen the privacy and security protections for health information established under HIPAA. Let's further understand the final omnibus rule. The final rule expands for patients' rights by allowing them to ask for a copy of their electronic medical health record in electronic form. The patient can pay out of pocket in full. They can instruct their provider or their doctor to refrain from sharing information about their treatment with their health plan or insurer. If a Medicare beneficiary requests a restriction on the disclosure of the PHI to Medicare for a covered service and pays out of pocket for the services, the provider must also restrict the disclosure of PHI regarding the service to the Medicare. It limits on how information can be used and disclosed for marketing and fundraising purposes. It also prohibits the sale of individuals' health information without their permission. In this slide, let us understand more on the final omnibus rule. The covered entity or business associate must conduct a risk assessment that considers at least each of the following factors. Those are unauthorized access or acquired of PHI or viewed the PHI. The breach notification final rule was amended with a requirement to determine the breach's risk of compromise rather than harm. Compromise was considered a more objective test than harm. Thus, breach notification is necessary in all situations except those in which the covered entity or business associate demonstrates a low probability that the PHI has been compromised. The breach notification rule also extends in which cases the, the notice has to be provided. The providers and covered entities must provide notice to individuals, to the media, if breach affects more than 500 residents of a state or a smaller jurisdiction, and or to HHS if breach affects more than 500 individuals regardless of location. The business associates or people or organizations that conduct business with the covered entity that involves the use or disclosure of individually identifiable health information must also provide notice to covered entities no later than 60 days after the discovery of a breach. More details can be found on the HHS website. Further on the omnibus rule, penalties to covered entities and business associates for non-compliances are based on the level of negligence with a maximum penalty of $1.5 million per violation. Notice of privacy practices forms must be provided by the covered entity to inform the patients that they will be notified if their PHI is subject to a breach. Business associate agreements between covered entities and business associates must be established to address the prohibition on the sale of patient records or PHI and or restriction of disclosures of PHI unless been permitted by the patient. Now we understand from the HIPAA rule sets why HIPAA is important in the operations or in the organizations. The first is safety and security of patient information or records, and the second is preventing security risks that could result in major compliance costs or loss of business. Healthcare companies, which can concentrate on growing their profits instead of fearing these potential audit fines. Thank you for watching this presentation. I hope most of the questions or queries are been clarified. Your feedbacks are appreciated.